Hey guys, I'm Michael Allen for TravelCostaRicaNow.com. If you have ever considered Costa Rica for stem cell therapy, have you ever heard the word before? Do you know what it is? We're going to be talking to some experts. The 101, will stem cell work for you? And we're with our friend Johnny, the medical tourism guru, I like to call him. He knows all the people, all the guys. That's how we're making this connection. And we're going to be talking about the 101 on stem cell. What is it? Is it right for you? Can it help you? Can you benefit? So if you guys could introduce yourself to kind of explain who you are and what you do here. And actually, where are we?
We're in the capital.
That's all right. What?
We're in San Jose. We're in an area of San Jose.
You're done.
We're in an area of San Jose called Escazu.
Okay.
For our friends in the States, you hear it referred to a lot as the rodeo drive of San Jose.
Kind of true.
Right? I mean, it's a lot of chrome and glass and very modern, and all the buildings and facilities here are, what people would be used to if they went to a place in the States, right?
Right.
But
this is because I saw regeneration.
So we're the Regenerative Medicine Institute is the clinic that we're in right now.
Okay, good, yeah.
RMI for short, here in Escazu.
This particular facility is unique. It has a lot of facets that you can, technology, but the most important, they have experience. A lot of clinics around the world have certain experience, have gone to a seminar or two, or are general doctors in two different areas. These are experts.
All right, so we're going to talk about that, but we're going to back it up a little bit. I know, what's stem cell? What it even, I've seen the word, but what's that even mean for people that really, they've heard it but don't really know, and tell them what you do first, and then explain the 101 of stem cell.
Yeah, well, my name is Dr. Federico Valde. I'm a board certified here in Costa Rica. Worked with stem cell in my last 14 years. And basically, stem cell is a cell can produce other type of tissue, all kind of tissue. So we have two types of stem cells. We have the embryonic stem cells that they derive from an egg and a sperm. We don't use that. That's other research, high-end research that they're being investigated from a long time.
So you don't use...
We don't use embryonic. We use adult.
I thought that was the big one.
No. So we use adult stem cells. Adult stem cells come from adult tissue. So basically, the most we use right now is MSCs. That MSCs come from adult tissue. You can extract it from fat. You can extract it from your bone marrow. You can extract it for umbilical cord. You can extract it even for your molars, menstrual blood. Those are sources of MSCs, what we call MSCs. We have other two types of adult stem cells that we call endothelial and hematopoietic. So what we do here is we combine the three of them so we can treat the patients on anti-aging treatments. That's what we do here.
So basically, stem cells are making new cells for wherever they're put in the body, like.
Yeah, one of the big differentiators about a stem cell than any other cell in the body is that it can differentiate. It can become whatever it wants to become. So, for example, a heart cell. Once it's a heart cell, it's always a heart cell. A lung cell is always a lung cell. A skin cell is always a skin cell, and so on. A stem cell is unique in that it's the only cell in the human body that can differentiate into other cell types, and that's what makes them
special. Which is why it's making,
That's what makes them special. To Fetty's point, to be clear on that whole embryonic versus adult cell thing, back 20 years ago when stem cells were, really controversial, and they were saying, oh, these embryonic cells, and there was ethical concerns, that's what he is referring to. That hasn't been done for a long, long time, with the exception of for research purposes. But when it comes to treating using umbilical cord stem cells from a full-term C-section live birth, that's where you collect the umbilical cords. And what he was talking about from an adult stem cell is it comes from the mother's, the tissue, from the umbilical cord tissue. And we collect and harvest those stem cells from the umbilical cord, and that's what he was referring to.
We don't have to hit this too hard, but why is it such a problem in the United States to get this going? Why is it, what's the big problem? Is it still unethical?
All right, so no, it's not about ethics. This is where you get.
Then it must be about this.
It's,
right?
yeah, it's about money. This is where I'll turn cynical, fairly quickly.
That's why we're taping you. We love cynical.
So I'm telling you, so Big Pharma has lobbied hard and heavy for years to make stem cells illegal in the United States because it disrupts the profit model, right? The profit model being this: we're symptomatic medicine based in the U.S., right? It's diagnose and treat symptoms, and every physician goes to school and they go to med school and they learn to diagnose and treat symptoms. You're going to get a pill or medication in order to feel better, not necessarily
For like the rest of your life,
As
because
long as
we
you
want to
take the
keep
pill.
you, yeah.
Yeah, and then as you age and develop other complications and age-related illnesses and disease, you'll get different pills to treat whatever those may be. We don't do root cause medicine in Western medicine, in the U.S., for example, and other Western medicines. We really deal around, we're great at acute care, right? If you
Right,
break
yeah.
something or something like
Yeah.
that, Western medicine, some of the best there is in the world. But when it comes to chronic conditions and or anything that's not acute,
We want to keep them
related,
chronic, right?
that's the model. It's the profit model, and quite frankly, it's reduced into 7-minute medicine now, and that's because these doctors have to have volume, right? The reimbursements from the insurance companies and the way big pharma and insurance work together to tell a doctor what they can and can't prescribe and what they will and will
Right.
not pay for. They're practicing medicine, and I hate to say it that way, but doctors' hands are often tied where they'll say, this is what I think would help you and what would work for you, but your insurance company won't pay
I think
for it.
people are starting to see this, open their
Oh,
eyes
no
a little
question.
bit more to this.
Yeah.
So tell the people, okay, they kind of understand stem cell now. What are some problems that stem cell could help?
So basically, there's a lot of things that stem cells can do. We basically focus in two areas. One is anti-aging, and we call anti-aging as a sexy term, right? But basically is making you age without any illness. Because, Western medicine got us to get to, 70, 75 years old, but your last 15 years are, pretty bad. Usually people they depend on other people. They start with, chronic pathologies, and they need to take a lot of pills. So that basically what we're doing here on the anti-aging part is basically getting you to those 70, 80 years old with the best health you can, so you can be independent and you can, be with your loved ones. On the other hand, we have all the autoimmune diseases and all the other pathologies that we're looking at as you age, Parkinson, Alzheimer's, and, all the autoimmune disease, lupus, what we call, and then multiple sclerosis, and all these things that, we're seeing more and more and more in the US and in America. And with that, stem cells can do a lot of things. They have an anti-inflammatory power. When you inject those cells, that basically it regulates your immune system and makes the immune system to stop attacking yourself.
And they're replacing old cells, right? Isn't this the whole?
Well, it's a mimic thing. It's
Sorry,
not.
I don't.
No worries. It is
No.
It is a basic question. So
That's the goal, to clear this up, right?
So you are in this state when you are attacking yourself in all of these autoimmune diseases. So basically, the stem cells go in your body and they just stop your immune system and say they shut down the immune system and say, well, you don't need to attack yourself anymore. And so that's what basically stem cells do. They tend to split. Every time they split, they secrete these trophic factors, these proteins that keep your immune system to be down, and so you regulate. That's the first thing that we do. The other thing is, back 14, 12 years ago when we started with this, is we saw in a lot of the patients the treatment didn't work. So now in these days that we have a lot of other testing regarding your genomics, your epigenetics, those are some terms that we're going to explain later, your hormones, your metabolism, your oxidative stress. Now we know there's another point that we can see. So when we inject your cells, you can be in the best shape you can. It's not only about injecting yourself, but it's making your body to see all the part, nutrition, exercise, and mental health, sleep. All these parts of your body are really important on a stem cell treatment. We look on those things, so you can have the best treatment you can.
So here, what you guys are doing now is mostly more anti-aging thing, as opposed to I hurt my back, can you help my spine with stem cells?
So yes, for the most part. In Costa Rica, we're really focused on aging, right? And aging gracefully with enhanced youthful function and cognition and mobility. It's interesting, Mike, I was reading an article the other day, and we're talking about the things that people who are aging, what they fear the most, right? And the number one thing is outliving their money, right? People don't want to, live longer than the amount of savings they've acquired or accumulated over their lifetime. Makes sense. The second thing is their independence. They don't want you moving in. Mom doesn't want you moving in with her, taking her car keys, and now she can't drive to the grocery store or her doctor's appointment or whatever it is on her own, or worse yet, being transferred to a facility, right? And so that independence is huge, right?
I would put that for me. That would be number one for me.
Mine too, yeah.
Right, without question, is losing that independence. So in Costa Rica, we're focused on those age intervention or age reversal therapies that we can do to help people. As we age, the number of stem cells, think of your stem cell pool, if you will, as like a tank of gas in a car, right? But you don't have a gas cap. So you get a car, you have a full tank, you drive it off the lot, and you've only got that one tank for your entire lifetime. But now we've been able to add a gas cap so that we can go in and replenish. Because here's the thing, when you're born, 1 in 10,000 cells in your body is a stem cell.
Right.
By the time you're a teenager, it's 1 in 100,000. So there's a 10x, you burn up, a 10x decrease just to reach your teenage years. By the time you're in your 30s, it's about 1 in 450,000. And by the time we're in our 70s, it's about 1 in 2 million. So if you looked at it on a curve, there's a decline curve, right? That's just steadily declining over our lifespan. And it's the main healing mechanism or component in our bodies. And in aging, there's other things. There's something called a senescent cell, or you've seen them online if people Google it as zombie cells. And they're increasing. So stem cells are decreasing, senescent cells are increasing, and that intersection is where all of your age-related disease and illnesses start to creep in. And it's almost, if you think of your body like an operating system, it's almost like there's this programmed decline, right? And it's nature's way of moving us out of the way to let the rest of the population catch up. It's a procreation mechanism, really.
So where's the research on this? Is everything is good, that's proven it works, or is it still in the stages of it's showing good things, we're on our way because you're doing it here? Is this, where is this? Is this still tied? This is so stupid question. Is it still tied to the stem cell that they don't do in the United States? Is this another aspect of the?
Well, first of all, and there's a lot of, even in the medical community.
What's the pushback on this? Is there pushback like going, that's quack science? They're just trying to make money or something?
Yeah, it's a fair question.
Yeah, it's a fair question. It's a lack of information, even in the medical community. There's over 3,000 papers, scientific papers out there that proving that this is safe. So for people that they are struggling on this treatment to be safe, it's already proven by science that it's safe. We have phase 2 and phase 3. This is really hard to explain, but when it comes to the latest stages of research, you need a lot amount of money. And so that's when it comes to pharma again, and who sponsor all these things is pharma, and all the insurance companies. So it's really difficult to get to the latest state of research. But all this phase 1, phase 2, and phase 3 that is really good scientific data is really, really good. And people doesn't know that. Even the medical community doesn't read this paper. So we have things with multiple sclerosis. You have papers from autism. We have papers for osteoarthritis. Rheumatoid arthritis, lupus. You can read in every pathology that there are scientific publications that even the medical community doesn't know. So I encourage people to go and look for all these papers, because we have found more than 3,000 papers on this, and that's how we base science, and why we base the treatments on several protocols as well.
What was Mel Gibson's dad doing in Panama? I saw that Joe Rogan thing. I thought he was telling Joe Rogan that his dad was on his way out. that's like 90 years old, and he's explaining the story, and somehow I can't remember how he got down there, but he got to Panama, got into must be something, the stem cell or whatever, or maybe I don't know what, and all of a sudden he's that was 8 years ago or whatever it was, and he's
almost 100 now.
Yes.
Yeah.
So I'm glad you know this story.
Imagine, you know, a guy like Mel Gibson with all the access in the U.S. to the best clinics, right? He got to his doctor in Mayo Clinic, and you know, first time he tell the doctor, say, don't go there, of course. That he got in a phone call with, you know, was my former boss, and I really appreciate is Neil Riordan, who is a PhD and start all this research 20 years ago of stem cells, and they got a really nice conversation. And basically, when you start talking to a regular physician about this, you will start knowing that they don't know a lot of this. So at the end, they decided to come, and it was a really successful treatment. Of course, you know, the dad was on a better shape, and then you know Neil and his family they started again to go there, and then you know it's a really good thing, you know. But I think it's more than injecting cells. You know, it's not about go there, put an IV, and get some cells. I think, you know, what we're now looking for, and we're in constant learning right now, is you need to see the other parts of your body, and you have to, you know, do all these checklists that everything has to be on the right place so you can receive the cells, and that's, you know.
These guys, I'm bringing these are experts. They're not just giving you cells, injecting, no lab, no scientific information. They know what they're doing. This is one of the reasons why you're here.
Yeah, I'm just missing. I guess that same connection of like, where's the person fixing his spine? You know, is that a thing? Are they doing that here, or is that Panama, or am I don't even know?
Joint pain and you know, back pain. So I go in the States. There was a portfolio of biologics, right? Stem cell derived products, amniotic fluid, Wharton's jelly, exosomes. There was, you know, a handful of others that physicians were able to use legally in the States to treat joint pain. So I call it's kind of the cover charge for being able to be in regenerative medicine as it is. We've got a lot of experience in being able to do that. If you're a reasonably good candidate for regenerative medicine treatment for joint pain, we can help you, no question, right? Backs and spines are a little trickier, right? You get into a little bit more delicate, and you need some specialty there for sure. You need the right facility. You want to make sure that you've got access to, you know, all of the equipment in the what-if scenarios. But when you're talking joints, hips, knees, shoulders, things like that, that's low-hanging fruit. It's very
okay, that's what I was wondering. Okay.
Now, here's something interesting. As of June 3rd this year, the FDA came in and enforced a rule in the United States, a law that was in the United States that was on the books, banning most biologics. It shut down labs. So what happened there for a while, for a few years, they operated in sort of a legal gray area where they were saying, if you're using this as an investigative new drug and you're using this consistent with a couple of regs in 361 and some regs, I think it's 361 for homologous use. I could be wrong about that, but I think that's it. Anyway, there were some regs on the books that said you as a physician could use this off-label, which they do with a lot of medications, in order to treat patients. What you can't do is market it and tell the patients, hey, look, I'm going to use amniotic fluid or Wharton's jelly, and I'm going to heal all these illnesses you have. They couldn't market it, but they could use it to treat these patients, and it was working fairly well. As with any sort of new frontier, some guys understood it well and used it appropriately, and others didn't, and they took advantage of this, and they didn't really know how to apply it well across the board. And so the FDA's sort of view on it was that there were patients that might be being taken advantage of by practitioners who didn't fully understand how to use it meaningfully and in a way that patients would have really good and successful outcomes. So on June 3rd, they said, that's it, it's over. You can use autologous or products that are from the patient. No more third-party products, which we call allogeneic. So now they basically limited it to PRP, and I think there's one other thing I don't even remember. Used to be that the labs could make it, sell it to the doctors could use it. Now the labs can't even make it. They shut it all down, and that's just a couple of months ago. So it's driven more people out of the country to places like Costa Rica and Panama to seek these root cause treatments, that they know are working and we know that have been successful.
We were talking a little earlier before we started. So how many people are actually doing this? And you were kind of saying, well, there are other people doing it, but you got to kind of be a little careful?
Yes.
Or is that...
So there's stem cell clinics all over the world, right? But I think when you and I were talking earlier, I was saying there's some art to the science. First of all, back to Fedi's point with physicians who don't understand it, they don't teach this in med school. When you go to in medical school, you know what a stem cell is, but you don't learn anything about regenerative medicine and treating root cause in commercial and clinical applications.
No money in it.
No, if you think about the training, it's all around the big pharma stuff and how to diagnose and treat symptoms so that you can prescribe medications. That's where your training comes in. So physicians, they know what they know and they know it well. And this is just not something that's taught. We talked earlier too, you and I were visiting before this about labs. When I was doing we had a distribution business back in the States. There were 2 labs who were doing exosomes, 4 years ago. And within a 24-month window, there were 1,300 labs that were doing this. Not all of those labs were as good as some, right? There were a handful, and so you got to know which labs were better at making the final product to treat patients and having, really improved and good efficacy. I'm saying that, I'm taking a long way around, evidently, to talk about there are labs and there are practitioners. The labs make really good, efficacious products and they know what they're doing. And there are practitioners who know how to use those products on the right patient for the right indications that will give them a really high chance of a successful outcome. That's what separates. That's the difference. There are people who know how to apply this and get good outcomes, and there are people who are in it that may or may not have that same level of expertise and experience. Yeah. Fedi tells you he's been doing this for 14 years. That's a long time in regenerative medicine, right, from a commercial application.
Yeah. So he's like an OG.
This is an OG right here, for sure.
Yeah, so, basically, again, we experienced a lot of the things, back in the 14 years ago, we started with MSCs from menstrual blood. We go to the fat, and with good results, and then some suddenly fat wasn't that good in some patients, and then we go bone marrow. So we have experienced all the sources of MSCs and stem cells, and we have learned through this past 10 years how is the best way to culture them, and try to narrow that efficacy to the patients just because of the experience of the lab, and of course that will have better clinical outcomes, and everything has to do with the expertise in the lab and the experience we gained through these past 10 years, and that I think there's a lot of people out there that they don't have this experience, right?
Yeah, Mike, the difference between what they're talking about is this, is that there's labs that produce the product, and then there's clinics that apply the product. What's unique about this particular situation is that they do both. You have the experience of many years of experience, and they also have a lab. Not every clinic has a lab. A lot of clinics, they'll buy product from third party.
Right.
They'll have them come in. They don't have the specialists. They don't have the experience. So when you do choose a stem cell clinic, it's not just that, oh, I got a good review from here. You look up the review, there has to be science behind it. They have to have a lab. The people that are practitioners that are there, do they have the experience behind them? Because a lot of times you choose a lab and they don't have that. Here, they have both.
So Mike, let me ask you a question. You're wanting this to educate your audience, right? Sort of this stem cell 101?
Yeah, for me mostly. Forget them.
Can I do? I have an analogy, or an example that I use quite a bit, like with my friends who go, "So Greg, what do you do again?" And then when I start to tell them, they get that glazed look, like, "Get me away from this guy!" Right? Like
I'm not glazed. That was just beer last night.
So, look, at the end of the day, we can bring it down to any level, but it's all about inflammation, right? Control.
Well, that's true. Yes,
it really is,
yeah.
and that's true when we do that through diet and exercise and sleep and stem cells. There's a lot of different ways to control inflammation, but here's a great example about sort of the power of stem cells and why they work and how we heal. If I were to roll up my sleeve and take a knife and cut my arm right here, I would create trauma, right? That trauma would create inflammation. That inflammation would send something called a paracrine signal in my body to recruit stem cells to the area to regrow this tissue and grow that skin back. It's why when we're younger, we heal fast, a couple of days, you can barely tell that you had a cut or a scrape or whatever. And then when you're older now, your mom or your grandparents, they have a bruise or a wound for a couple of months at a time. They have fewer stem cells. When we're younger, we have tons of them. And the ones we do have a ton of growth factors. So that inflammation that I created right there when I cut my arm, that's good inflammation in that it signaled the healing cascade for the stem cells to come to the area, regrow that tissue. The same thing is happening on the insides of our bodies with all the other processes, right? That's good inflammation. If we all live long enough, what'll kill us all in the end is inflammation. We call it old age, but at the end of the day, you just can't fight the amount of inflammation in your body anymore that's overcoming all your vital organs and processes and systems, and you wind up moving on, right? So it's stem cells happening, that's a good external version of it. Here's another one. When you see wrinkles in the corners of your eyes, ladies, for the first time, that's the first sign of DNA damage at the cellular level. And that cell and that tissue is now starting to die and decay, and that's why we're even seeing non-surgical stem cell facelifts, right? You're able to use, because they come back in and regenerate and regrow this tissue and smooth those lines out. But it's all happening inside, just like it is on the outside.
So
maybe that helps.
No, it helps a lot. I'm glad you're dumbing this down for me, because
it's not for you, because I know you get it.
So just so we can weed people out of like crazy questions. So let's say somebody's a good, they can do the stem cell thing, they pass your test, he's going to be a good candidate. I know it depends, but what's like a ballpark figure of somebody that needs some sort of service of what we're talking about? Is this $50,000? Is this $5,000? Is it you can't even do it? You have to go over here? I mean, where is that in like the ballpark of money?
Well,
I like how you stepped in there.
Always go talk about money.
Because that's the question. After all this, they go, I love what they said, but how much does that cost?
Because everybody asks
get
this,
it.
right?
Yeah.
Well, you know what? I'm going to help them a little bit on this. Everybody's different, and yes, it's subjective. But a lot of times when we're looking at a patient, it's what you're trying to treat. Are you trying to do an anti-aging treatment? Are you trying to do a chronic disease? Those are all factors.
Okay, I'm going to push back on you before you do this. But I want a ballpark somewhere.
He wants a number.
You're going to have to give me a
Okay.
number. Yeah.
Right.
Okay, go.
Well, you
Do I have to be Mel Gibson? Is that what you're trying to do?
No, you do not.
the treatments vary from $8,000 to $50,000, $100,000. That's based on what treatment's being done. There are certain treatments.
And I'm sure Blue Cross pays for this, right?
Sure.
Maybe not.
This comes out of people's pockets.
No.
Yeah. Look, we're looking forward to the day that it becomes more accessible, right?
Which it's obviously
Because
going to, right?
$8,000, let's face it, is a lot of money, right? To some people, right?
That's kind of a big thing, though, too. You're getting kind of pretty good bang for your buck, aren't you? A
Without
little
question,
bit?
the ROI is there. But look, like to Johnny's point, there are people with critical illnesses that may need 2 or 3 treatments, to bring this down, and that's where you can get up into the 50 to 100,000 range fairly quickly, right? But on average, if you're looking for just an average number, between $20,000 and $30,000 for a lot of the patient population is a pretty good number to use, because I don't want to disappoint your audience and act like I'm trying to dance around it. If you say between 20 and 30 on average, you're probably going to address most of the patient population. Is that fair?
Yeah.
But I'm assuming as this research gets better and better and better and things get more out there, you know, obviously maybe costs go down a little bit more eventually, may take 20 years, but it's going to go this way, right? You can't stop the truth in a sense, can you?
No.
Big Pharma can try, but eventually it's going to, people are going to go, wait, this does
It'll
really...
get more exciting, like space travel, right? I mean, like I think that with all these private planes, people running into this space game and all this now, you know, we won't have to be a millionaire to go and do a low Earth orbit. I think eventually, 5-10 years from now, maybe my kids will be able to go, you know, do this, you know, for a weekend for 10 grand or something, right? But with stem cells and with regenerative medicine, we're going to make it, it's going to get more and more accessible. But if you think about the infrastructure and the amount of investment that goes into the lab and the physicians and the clinic and the safety and efficacy of all the products and the treatments and the diagnoses, and it's not just, you know, Johnny mentioned this too, and Fetty said it. There's a lot of places you can go that you can go down there and get a stem cell infusion. They will do it. They will send you on your way, and you will never hear from them again. And there's no follow up after. That's using stem cell and regenerative medicine as a magic bullet, which I do not believe it is. And I know Dr. Valde doesn't either. Neither does Johnny. It's not a magic
If you
bullet.
said it was, I'd turn this video off and never put it up.
100%, right?
You know, be like,
But there are places that because
kind of do that.
Yeah.
they kind of do, and I don't bash. I'm not about that.
I will.
I look at it as a puzzle piece, right? There's one piece of the puzzle, but there's some lifestyle component to this too. I'll give you a great example. If we, you know, in the States when we were treating joints, you would have a person that would come in and he would be morbidly obese, diabetic, pre-diabetic, smoker, sedentary, horrible nutrition, just bad lifestyle stuff. And there was so much going on, and they would have money. They were perfectly capable of paying for it. And they said, my knees hurt. And first you're like,
Well, no shit.
no shit, right? Yeah, of course. And they would say, I want to do this. I want to get my knees injected. And we would tell them no. Not everybody would, but we would. And they would say, but I'm standing here with money, I can afford it. And I would say, here's the problem. It may make them feel better for a month or two, right? But there's so much else going on with this person and this patient's health that in a few months, they're going to start hurting again. We know that. And they're going to go out there and they're going to tell everybody, that doesn't work, or don't go there, that doesn't work, or those guys, because there was so much good. And there were plenty of people that would take that person's money and treat them and they would get some temporary relief. But if you can help that person lose weight, and you can get that person to stop smoking, and you can get that person exercising, and I will tell you that when we did that, 20-25% of the people would take us up on it. The other 80% would go down the street and give the money to that guy down there, and they would do it, and sure enough, they would come back and say, okay, you were right. Lose some weight. So when I say it's a puzzle piece, there's some lifestyle component. We have a role in this, right? Everybody, right? If you're not going to do your part, it's not going to be a long-term outcome.
Right.
You may get some temporary relief.
Seems to make sense, but a lot of people...
It's very expensive temporary relief, right? So I want it to last. I want, you know, our goal was I don't want to see you back here for 2 or 3 years when it came to joints, right? I want it to last that long, and I will help you do that. But with aging or with critical illness, with anything, you have to do your part. And I think that's really important for your audience to understand is if you're going to go home and sit on the sofa and have poor lifestyle choices, you're going to kind of get what you pay for in a way, right?
Why would you want to prolong that life? They need to go anyway, right?
You know, it's funny you say that.
What is that?
Yeah.
What are you doing? You're sitting there.
We deal with that in aging all the time. People say, well, why would I want, you know, to live an extra 20 years with you know, of that part of my life? Well, if you're healthy and mobile and cognitive and your libido is still healthy, you would, right? You want to. So the extra decade or two we're talking about is you know, where you're functional and you're mobile and you're
It's that whole independence thing again.
It's that whole independence
Hey,
thing.
I'm only
can
gonna
help do that.
I'm only gonna shut this down because our phones are probably about
No,
done.
you're good. Well, you know what, Mike? I want you to take these guys here. This is they're giving you an ethical. This is why we're here.
No, I know, and I appreciate that because it's the only I don't talk.
They're not trying to sell secret sauce or we're going to do something. They're taking it all in one place.
Johnny, that's why we're friends. I trust who you recommend me. I don't do this with everybody because I don't want to have my time wasted, and I get mad and I have to take the video down because I find out you would inject the person just for the $5 or whatever, you know? I don't like it either, so I appreciate the honesty, you know, of the whole thing. So, but thank you, actually. I've learned a lot. I just hope there's not a quiz. Anyway, guys, if you're interested, sorry, I'm over here. If you're interested in this, what we're talking about, I'm just going to tell you, you email me, I'm going to push you over to Johnny, and he can work this all out if you're interested. Anyway, guys, thanks so much, man. Thank you.
Thank you.
Thanks, man.
Thank you.
Thanks, Greg.
Thanks, John.
Thank you, man.
Thanks, Mike.
All right, guys. Hey, guys, I'm Michael Allen, travelcostaricanow.com. Peace, guys. Hope it helps. And that's D'Angelo back there. He said nothing.
I can see my reflection.
Oh, can they?